is the culture of the fire service needs to adopt some of these best practices, right?
Hi, Chris McClune here, and this is Live at FDIC. The studio is brought to you by Firehouse Subs and the Firehouse Subs Public Safety Foundation. Enjoy more subs, save more lives. Find out more about restaurant ownership at www.firehousesubfranchising.com. Well, welcome back to Live at FDIC. Again, we're going to be talking to some representatives who have some involvement with TFT in addition to a TFT representative. First up, we've got Deputy Chief Jimmy Hodges with the Indianapolis Fire Department. We've got Chief Eric Valliere. He's the FDSOA chairman, and he's with the Scottsdale, Arizona Fire Department, FDSOA being the Fire Department Safety Officers Association. And our TFT guest is Eric Ward. And Eric, I don't have your title here. What is your title there at TFT?
Segment leader of health.
Okay.
I got a promotion right there. I don't know if you caught that.
Well, okay.
I'm the division
put my
chief.
glasses on to make sure. Is it battalion chief?
Division chief.
Division chief.
Division
my fault
chief,
on that. I see DC. I think deputy. Okay. Well, congratulations on your promotion.
Thank you.
It was my pleasure to recognize. It's my pleasure to recognize your achievements and move you up the ladder there. So we're going to talk today about health and safety. We're going to be talking about some of what TFT has been up to promote firefighter health and safety, some of its initiatives, some of its products. And first I'm going to talk to Chief Valliere. At the FDSOA, you get to see a wide range of safety challenges facing firefighters, not only here, but also globally. How does the FDSOA help individual departments address these safety initiatives, these very important safety initiatives, without losing sight of reducing the long-term risks of health risks like cancer? And just like as an example, I mean, we see a ton of it's along the lines of taking care of yourself now, so that when you retire, you can enjoy those sunset years. So talk a bit about what you see.
Sure, I'd love to, Chris. Great question. The FDSOA is all about training, giving guidance, and looking at best practices. Our feel is that if you address the earlier parts of what's important with safety right away, and now in the real time with some of the most important research that's out there to give our firefighters the best information and the best tools to do their task and deliver their mission, it really looks at and helps with that long-term effect, like cancers, cardiac risk, those things. So we do that through training. We have training programs, we have conferences that come up. We offer specific guidance. They can call FDSOA if they have a particular question that we can help them with. We have resources available to them to help them do their job better. We advocate for new initiatives across the country. We sit at the table with the U.S. Fire Administration on some of their Cancer Alliance missions and some of the behavioral health committees they have. There's just a lot of things that we're trying to do, as well as work with researchers like Jeff Barrages and U of A, and supporting some of those important research studies that are coming out of those programs. Grants are awesome things to fund because they help the fire service learn how to do things better. You break it down, most of the time we break it down to the fire ground, what's important and how we take care of our people on the fire ground. And we'll talk a little bit about it now, I'm sure, at some point. But air quality, not only on the fire ground, but in the trucks and in the stations, are critically important to the health of the firefighters.
Okay. Now, Chief Hodges, I'm just going to say Chief, so I don't
that works. That
mix up
works.
the D again. Your team uses some of the air decon solutions from TFT Health, but I mean there are a number of things also that the department is doing, and that you have done in your role. What are some of the things Indianapolis is doing, and what's the criteria you use to decide which area to invest in?
These are hard decisions to make. It's an emotional topic. I don't think I'd be speaking of the topic if I didn't talk about Joel and Craig, two fire service brothers of my own that paid the ultimate price in their early 40s with young kids at home. It's emotional, but we try very hard to be data-driven, look at the white papers from the organization, Cancer Support Network, Safety Officers Association. We try to use these real data to make the right decisions. We did put the Crew Protect systems in the largest apparatus order we've ever placed, 20 apparatus coming in this year. We're really excited about that with our new paint scheme. It's a great thing, but it's got the Crew Protect system inside it. And we thought that was money well spent to keep our people safe. We try to get them to clean their gear. We have policy that says you have to send your gear in for cleaning. We just issued particulate blocking hoods within the past couple of years. One of the guys said, well, I know why this works. And he said, I can't put it up over my nose and breathe through it anymore. But yeah, so we've done that. Looking at our own data, it's hard data to collect on a small scale when it's a real world problem. We don't want to have firefighters die to add to the numbers. We try to get ahead of that. One example I could give is we had air scrubber systems in the stations, and the furnace filter was full. It was dark, visible diesel soot. So we've gone to all hose systems in our stations.
Okay.
Yeah, getting the guys to use those has been a challenge. The Crew Protect system we put in the engine is passive. If the battery's on, the fan's running, and it's air's being filtered. So I hope that answers the question.
Oh, absolutely. And not to take away from what we're talking about here, but there is, for anyone who's here, an Indy rig on the floor with the new paint scheme, since you brought it up. Just in case anyone wants to go see it. But also, since I've been here in Indianapolis for the show, I visited Station 3 in Indy, and Battalion Chief, I'm forgetting his last name now, but he went through all the different health and safety initiatives that were placed into that station. What I was most impressed by was the redundancy in the diesel exhaust systems that are there. So I got to see exactly what you're talking about, in person and in service, and got to see a lot of the current construction designs that are going into stations these days that include the moving from the hot zone into the cold zone, the new places for turnout gear. So it's all and doing as much as possible to keep the possible any possible, I'm forgetting the word I'm looking for, but keeping the carcinogens or anything out in the engine bays, and keeping the living areas completely clean of that stuff, reducing the risk of exposure.
Yes,
that's what I was trying to get to, and it just took a little bit of a minute there. But Eric, now coming from a personal connection to the firefighting community, through your family, and considering what both chiefs have said, how does your team at TFT approach creating products that can impact the everyday safety of firefighters?
Yeah, I appreciate it. So, we had an opportunity to talk last year, and at that time we were, largely talking about our hypothesis and what we felt and thought, which was, air quality is important. We're going to find it to be an issue in a lot of stations and a lot of departments, and that's what we're focused on. And I can tell you, a year later, we're still looking at the same area, because when you talk to guys like these, and we talk to the departments, talk to the line firefighters, you hear about all the things they're trying to do, all the responsibilities they have, a lot of things that are compliance-based that they're trying to get their teams to do. And a couple things, sometimes it doesn't, those best practices don't fit into the reality of the job. But on the other side, cultural change takes a long time. So, we see that what we can do is focus on the air quality and exposure reduction, because we can't change that. Someone doesn't want to wash their turnout gear, that they don't want to swap their fire hood, that they don't clean the truck, at 3 a.m. after a 5-hour job. We can't impact any of that, but all of that rolls up into air quality issues, and we know we can address that. Best in class, we can take care of that issue. So we like to try and help the cultural shift as well, but we know, quality air cleaning products are the biggest impact we can have.
Right. All three of you, I've just got one final question for you as we start to wrap up. What do you think is the biggest risk or challenge for the fire service today as it relates to health and safety? Chief, I'll start with you.
The biggest, that's a tough question to answer. I was going to talk a little about, I think two things can go hand in hand, as we're being pushed and pushed and pushed to be more environmentally friendly. And I think idle reduction could reduce some of the on-scene diesel exhaust that our firefighters are exposed to. When I was on a small volunteer department in Michigan, Lowell was pretty progressive, and we got to use, we implemented 20% biodiesel. This is old information, but when we went to 20% biodiesel, the particulate in the exhaust went down by 24%. And that's real world numbers. We didn't do that research. We took that research from scientists.
Well, I'll tell you, to kind of add on to what you're talking about, there's so many new and up and coming concerns that the fire service has, from lithium ion batteries, those kind of things, right? And when those are on fire, they're off gassing some really nasty chemicals, right? Where the products of combustion today are way different than what we were dealing with many years ago. I think really the most important thing, and Eric touched on it a little bit, is the culture of the fire service needs to adopt some of these best practices, right? We need to slow down. We need to be vulnerable. We need to use the tools that are given, and really look at what that lasting effect is, not only on them, but the next generation of the fire service.
I think we need to fight the all or none mindset. We say, so if I wear a particulate hood and have this system, none of us will ever get cancer. We know that's not true. And none of this is all or none, but we've got to make improvements and recognize that improvements.
So, we train safety officers not only on the scene, but as program managers to deal with some of these things, and we call it bringing safety to the street. But the key for an organization is really to develop a culture, right? They don't want safety officers to be a code enforcer. They want to be a cultural reinforcer. And some of the things in the products that, and I'll let Eric finish up here, that TFT and some of these other organizations are doing, their mission aligns with our mission to keep our people safe, right? And that's the most important thing. And I can tell you personally, Eric and his team are wonderful people that care about the fire service and firefighters.
Eric, how about you?
Yeah, I think so. Last night I got an opportunity to meet Frank Lieb for the first time from FDNY, and a while back I saw something he said on LinkedIn, and he said that I'm paraphrasing, I'll miss it a bit, but he said the problem of cancer in the fire service is a series of small insults, that it's not one thing. And for us as a company that makes a product, we hear a lot from the fire departments, hey, I have to look at the return on investment for what we're doing. And that's absolutely the right question. You need to invest in the right areas, but like you said, there's not one thing that they can do. They're going to have to change a lot of things along the way. And we're seeing that huge cultural shift across the fire service. So, the ROI is not going to be easy to measure everywhere. So I think it's really, again, we look at air quality because we say, okay, all of these other things, when they're not done, they lead to air quality issues. So while leaders in the fire service are trying to push that change, let's fix the problem right now, the symptom of it, while they're working on the cause.
Okay. Well, Eric, Chief, thank you very much for taking some time out during FDIC to come and sit down and talk with us. Eric, if anyone is here listening, first, for those who are at the show, where can they find TFT? And second, if they're not at the show and they would like more information on some of these initiatives that TFT is doing, where can they find information on that?
Yeah, absolutely. Here at the show, so booth 5010. Come by and chat with us. We'd love to talk to you, see how we can help. Otherwise, they can also visit tfthealth.com.
All right, perfect. Well, again, everyone, thank you for joining us. This has been Live at FDIC. Have a good one and stay safe.
Thanks for having me.
Thanks.
Thanks.